Assalamu alaikum. Today's video is basically a continuous video of my previous video, that was how to spend time in first year of orthopedic residency. It is very important that we orient our residents, our colleagues, our orthopedic family, that how the time must be spent during your residency, so that you have maximum benefit at the end and you achieve your goal, that is to pass the exam and to be a good surgeon and to have excellent training. No doubt, whatever we tell you, we can't change the system, that is hospital to hospital, that varies hospital to hospital, and we have different system when we compare it to the Western countries, that we can't make the system uniform. There are some differences, but still I believe that one goal, one thing is common in all the resident, and that is to pass the exam. And in the end, we have seen many residents who are from centers that you think that there is less surgical work, but still we have a good passing percentage over there. So still I will say, in whichever center you are doing residency, stay there now and work with dedication, with sincerity. Even the centers with less cut work, but the quality cut work, they produce some quality surgeons. So I still believe that sometimes quantity doesn't matter, it is the quality that matters. So first of all, you must aim for entering into a system that is having more surgeries, quality surgeries, and that have number of outdoor patients increase at that setups, and also at centers that have some study oriented classes. So let's move on for the to the second year. In first year, you have gained many things to orient yourself about orthopedics. In first year, I told that you don't know anything about orthopedic, but in second year when it starts, you can say that I know something about orthopedic. Yes, you know something about orthopedic and not a lot of thing about orthopedics in your second year. So second year is uh, comes very quickly. That's what I think. That first year passes very quickly, although the whole training passes quickly. But the second year comes very early, and a person thinks that I still have time, but he doesn't have time. The training, one third part of the training, or more than one third, has ended if you are going to have rotations in the end. So I know something about orthopedic. That's good. If you have followed my first year orthopedic residency guidelines, so at the end of the first year you are going to have some knowledge of orthopedics. What is the aim now? The aim is still the same. I want to pass my exam at time, I want to be a good surgeon, and I want to get a good training. So first year has passed. Even if you have if you think that you have wasted your first year, don't give hope, give up the hope, and start with your aim. What is your aim? Aim is to pass the exam, be a good surgeon, and get good training. So still the same thing applies in second year as well. Be goal oriented, be systematic. Don't go haphazard. I believe that in my training I faced this problem. I was not that much oriented by people about what to study, what not to study. So there were some issues of being haphazard. So be systematic. Then year-wise goal, the second year has some goals. I'll keep on telling in detail in my next slides. So year two is a year of partial responsibility. Year one was year of orientation. So year two is a year of partial responsibility. And in first 6 months, try to take the responsibility. In the first year, you do not take the responsibility. The whole responsibility is on the chief resident or on the badge in charge, senior registrar. So in year two, start taking partial responsibility. It is not a thing that you do it yourself. When you show your concern, when you show your responsibility, the senior likes that this person can take the responsibility. They start giving you responsibility. So it is a passive thing apart from being active as well. So it is a year of partial responsibility. Show your concern, show your responsibility, be at the front, and you will have feel good as well. So orientation of books and goals. Now I think in the second year you must know what books I have to buy, I have to get, I must have in my room, and what books to study. I think the videos that I have posted about FCPS preparation, these are for if you have started the preparation in the third year or after the training, so then we don't have enough time to choose books to study all books. I personally believe that you have a lot of time in your 3 years, and you must consult multiple books when you are reading a topic. So I must say that in your room you must have Campbell Operative Orthopedics, Miller's Orthobullets hard copy, Handbook of Fractures, and Surviving Orthopedics Clinical Guide for OPD and indoor patients. And apart from this, you can have other orthopedic stuff as well. Apple's Orthopedics is also good to have in the room. And other than that, there are many books. I personally believe that spending on your books never you will never regret after spending on your books. Do spend on your books. You must have a library of orthopedics in your room. You are an orthopedic resident, you will have it. You can have Rockwood Green and other books as well, but I have only mentioned these books. That do study all these books. If you are going to study, for example, pediatric orthopedics, then I would say that you must study it from Campbell. Then Miller and orthobullets must be given a glance, so that anything new can be added, because this is the time when you can do all these adventures and all these things. After that you will not have time, you will have stress, and the things will not be that much feasible for you in the long run. So these are some golden tips. I think in the if you are a hostelite, then make a person your study partner from the ward. If you are even a day scholar, make a study partner. You can have discussion with him on the WhatsApp. So if you don't have study partner, then have some good terms with a senior registrar or chief resident, and keep discussing with him different cases. It will help him as well and you. And I think in the second year, spend 2 to 3 hours of daily study. If you are doing this, in the end you will be able to pass the exam in first attempt very easily. There are many questions about part-time job. Can I do part-time job in my training? Well, I would say eat less and have some less adventure and fun during your training, and do not do part-time job. I personally recommend, do not do any part-time job. Stay focused, keep your mind relaxed. You must have some free time as well to keep yourself relaxed. Keep yourself relaxed, give time to your family. If some people have financial issues, still I would say manage it somehow. Do not do the part-time job. And can I do part-time practice? Well, you must not do practice at all. Even if you are belonging to some periphery and you think that you want to start practice, I would highly recommend, do not do practice. Even at the end of the training, do not do practice unless you have passed the exam. There is a hell of a difference. I have passed through all the experiences, and I'm sharing my own experience with you along with other experiences that I have seen. So these are my golden tips. Rest, uh, everybody is wise enough, but these are my golden tips. So year two, last 6 months, what to do in the last 6 months? Same as I have told you in year one. I will step by step tell you what to do in OPD, inpatient department, indoor OT, and emergency department. What to do in inpatient department. It is not very different from the first year. You must keep your clinical exam book in your pocket. We have made surviving orthopedics pocket size, and it is very handy to use. And now you will start understanding more and more things. If you want to have something more, you can watch my videos as well, or you can have consult from Physiopedia. So significance of ward beds, it is very important, as I have told in year one as well. See, ward beds are a key to pass you in clinical exam. And now You must discuss with your senior and must give possible treatment plans, complications, and fracture types classification to your seniors. And key, now this is the year of responsibility and discussion. Start discussion so that something comes out of your mind what you have understood and you have learned. What books to consult? So same books as in the first year. In OT, I would say the still the most important thing, patience. And now you have to behave as a good assistant. In the first year, you were trying to be a assistant, and now you must be polished to be a good assistant, and you must be that good assistant that all the consultants, all the professors of your team must think, not think again when they are asking you to wash up, because I know we ask those people to wash up whom we think that they will facilitate in our surgery. So be a good facilitator, be a good assistant, be multitasking. You have to be multitasking, not in every aspect, in preparation of the patient, in even in assisting, even in post-op management. Now you have to deal the patient as a whole, whether the operating surgeon is someone else, but you have to take the full responsibility of his pre-op care, is operate during the operation, and his post-op care. You must start writing operation notes, post-op notes. This will help you a lot. This clerical work will help you a lot. Most important point, how to prepare a patient for surgery. This was first year goal. And now the preparation of difficult cases like arthroplasty, arthroscopy, and some arthroplasties that require some special things like revision arthroplasty. So you make yourself familiarized with difficult cases now. And remember, now take the full responsibility of the patients, starting from pre-op, operative, and post-operative. It is not your, you are not there just to assist. You have to take the full responsibility. And what I feel, that whenever my professor comes for case, and I was assisting him in second year, the first of all, he questions me that what are the findings of this patient on MRI, on X-ray, and all that. So before the arrival of the surgeon of or your consultant, you must have each and every knowledge from the patient's file, and you must know that the consent has been taken, because in Pakistan we are having a lot of issues regarding these all the paperwork. So you must see, start from zero. Patient has been, consent has been taken, pre-op medication has been given. What are the findings? What are the what are the MRI finding, X-ray finding, CT finding, whatever there is, and what is the plan of operation, and what is, have you, and I think you must have discussed when you know that tomorrow you are going to assist a case. You must have a good discussion with the surgeon. You must ask him, sir, whether you need something for me to arrange or not. This will give a good impression, and you will start understanding things. This will help you a lot. Otherwise there is no fun, there is no use that you are assistant in an operating room, and at the day of operation you meet the surgeon and you assist him, and everything goes in that way. It will not benefit, not even the patient. If you have seen patient one day before the surgery, discussed with the surgeon, done the pre-op planning, done the did a good assistance in operating room, and post operatively, I think uh, whether there are 10 patients you have assisted, on your way back to home, you must go and check every patient you have been assistant or the surgeon. I have seen and I have learned from my professor that whether whatever case he has done, even if it is a case of a simple carpal tunnel syndrome, he sees him before leaving the hospital. So I think we are not given the proper guidance regarding what to do, what not to do. So you are a resident of second year, you have the responsibility. You must see the patient pre-operatively, discuss in detail with the surgeon. If you think that surgeon is not interested, still you have to discuss it with him. And if he is not interested, then this is the other thing, but you have to discuss it with. But I think he will encourage you, and he will give you some additional information as well. Then post operatively, take the responsibility of the patient. It is very important to behave like this, otherwise there is no benefit of any of the training that you are going through. uh, people complain that we don't have enough cut work, we have only one case tomorrow in the list. So what if you prepare that case from the start to the end and discuss it? It is better than doing 100 cases without any discussion and responsibility. Then comes the OT theater. Yes, I think now there are some different things. When you are in second year, now second year you at home, you must one day before you must uh, learn and read that procedure from Campbell and from AOSR, and you must know each and everything about the cases you are going to assist tomorrow. Or if you are not sure that in which operating room you are going to be, although we have a system in which we already know which will be our theater tomorrow due to our professor, but if you don't have such system, then I would say you must go through the whole list, and if it is too lengthy, then as many as you can read them from Campbell and AOSR. And then OPD, same as in OPD. Now try to diagnose the patient yourself, and if you are unable to diagnose, then consult your senior. Do not go on every case to your senior like I advised you in the first year. So in every OPD, likewise you were doing in first year, request a patient to stay for a couple of hours and then examine him in detail. Well, on OPD day, I would say if you are in a hospital, OPD, OT, or emergency department, these are 6, 8 hours. Then be sincere to the patients, be sincere to your training, leave all the fun. There are other times of the fun when you have completed your job task. So OPD, what books to use? I told you already, and these are very important. Book clinical exam book is very important. I would highly recommend this clinical book that is written by me and my professor. Emergency department. Well, with every passing year, the emergency department becomes more important for a resident, and the responsibility. I think the resident thinks that it has become more important because I want to do the cut work, but I still would say that now the responsibility has increased. You must take the responsibility of the patient. It's not that a patient has came and you just want to put a plate or put a nail in his femur or tibia. Basically, what you want to do is you want to have that patient from the start, do the ATLS protocol, do every pre-operative workup, have a good knowledge about the fracture, and before in emergency department, I think it's better to read quick procedure from AOSR before doing that procedure. And now in emergency, you start discussion with your senior, and what you have discussed and learned in your first year, start teaching to your juniors, because I believe that teaching is great. It helps you a lot to memorize and learn things. So teaching anything to your seniors, so to your juniors, can be very helpful. And still the same things, learn how to behave as a resident. You are a resident, you are not a consultant. No, you are not stay away from the things that make you proud or make you think that you know everything. And please use your authority in a good way. Be sincere, be tolerant, be patient. Learn how to stay calm. I would still say this because these things help a lot in future, I must say. Then be a safe surgeon and a good assistant. So in second year, your goal must not be to a good surgeon. In second year, your goal is be a good assistant, an assistant whom every good surgeon wants to wash up with him. You must be a good facilitator. If you are a good assistant in a second year, I guarantee you a good surgeon in future. So, still the same thing, wash up with every surgeon, even the surgeon you have realized in your first year that he is not, he doesn't have a good surgical hand, still wash up with him, help him, and see the things he is doing that must not be done, and you will learn these things as well. And in emergency department, these three books, these two books and one online app, this goes on for 3 years. So I think at the end of the second year, your handbook of fracture must be like you have gone through once from your handbook of fracture. If it is, then you are going at a good speed. And in the end, golden tips still the same: be goal oriented, be patient, and online, whatever videos, articles, and other stuff about orthopedics you are getting, keep reading them. Do relax yourself. But I think I have told you that in second year, spend 2 to 3 hours after your job daily to study. If you are doing this, then all the other time you can have some fun. Present your case to professor and consultant. You must be able in the second year that you are confident enough to present, and you have got a lot of humiliation during your first and start of second year, that now your humiliation curve has gone down. It's just for a joke that this humiliation basically is a very important thing for a resident life, and it helps him. So this last thing I told you last time as well: be in ward half hour before, leave the ward on time or half hour after the time. But the first thing is very important: be in ward half hour before the time. And now I have added 2 slides about the synopsis. Synopsis, I think, must have been submitted and approved at the last 6 months of second year. So I would recommend you must have written the synopsis at the end of your first year. And in the second year, in first month of second year, it's better to get it submitted. And then at the end of the second year, your synopsis has been must be approved, and your dissertation is about to be completed in a month. And then at the start of third year, I think your dissertation must be submitted, not late than this. So I hope this video will serve the purpose, and you will follow some of my advice or tips as a your brother, as a your colleague, and as a part of your family. My purpose and my aim is just to facilitate, and it's nothing like to make you people feel that you don't know anything. Well, you know a lot of things, but what I am doing, I'm just sharing my experience, and I want to facilitate all of my brothers, and I want that we prosper and we become good orthopedic surgeons, because what I feel that we are not producing that good orthopedic surgeons. An orthopedic surgeon must be a good orthopedic clinician. He must be able to diagnose and facilitate the patient. We must do justice to our training. We are not doing justice to our training. We are just criticizing the supervisors and everybody. We are not looking at ourselves. So, still, with all the prayers and good wishes to all my brothers and family and colleagues, I think this video will serve the purpose.